What's up everyone, this is Dr. Webb here. Thank you guys for watching this video. Make sure you subscribe. New videos coming every week. You don't want to miss them. For those who are new to the channel, welcome. My name is Dr. Antonio Webb, a orthopedic spine surgery fellow. So in this video today, I'm going to be talking about my complete fellowship rotation schedule. I just graduated from residency about a month ago and just recently started fellowship. So similar to residency, we have rotations in fellowship. During residency, over your 5 years, you rotate in different subspecialties of orthopedic surgery. You spend 2 months on orthopedic foot and ankle, 2 months on trauma surgery, 2 months on oncology, 2 months on pediatrics, 2 months on hand surgery, 2 months on shoulder and elbow, and then you repeat the process the second year or the next year, and then it's kind of varies in terms of what order that you'll get. So by the time that I graduated from residency, I had completed a total of about 13 to 14 months of trauma. Some specialties like hand surgery, you may do like 6 months during your training, or pediatrics, it's required that you do 8 months or 6 months. I forget the exact number, but before you graduate, you have to complete a certain number of cases and do a certain number of rotations to be an orthopedic surgeon. And each rotation in residency is a little bit different in terms of the hours, what's required, how much responsibility you'll have, how much autonomy you'll get. So it varies. During your fellowship year, it's a very similar process for orthopedic spine surgery, and for most orthopedic programs for fellowships, it's a year-long fellowship. So for oncology, it's 1 year. Some programs are 2 years. For foot and ankle, it's additional 1 year. Sports medicine, 1 year. Pediatrics, 1 year. And I'm doing a spine fellowship, which is 1 year also. So over the course of this next year, which runs from August 1st to July 31st of the next year, you do rotations. You rotate with certain doctors and certain specialties inside of that particular fellowship. I am doing a spine fellowship, so there's different parts of the spine that we have to learn. We have to learn how to put screws in someone's skull to their cervical spine. We have to learn how to put screws in someone's thoracic spine and their lumbar spine, and also their sacrum. And there's different types of spine surgery. There's minimally invasive, which means making small incisions and maybe looking through a microscope or a little tube and then using a microscope to do the surgery. There's surgery where it's degenerative surgery, where patients have arthritis and you're doing like disc replacements in the neck, or you're doing fusions, like one level fusions, like you're just fusing one portion of the spine. And also there's the bigger portions of spines, deformity. So you're dealing with patients who have these weird curves in their back. They can have like 70-degree curve in their back, or some type of infection or tumor that has eroded that portion of the spine. Well, a deformity spine surgeon will usually take care of that. There's pediatric spine surgery as well as trauma spine surgery. So lots of different types of spine surgery that people tend to focus on. And then most programs give you training in all of these aspects of spine surgery, and that's a well-rounded program. You get training in trauma, you get training in degenerative type cases, you get training in deformity type cases. So when you come out, whatever comes in your door, you're pretty much comfortable and you can take care of that particular patient's needs. So the way our fellowship year is set up, and it's 5 fellows, there are about 20 or plus spine surgeons in this particular group here in Dallas, Texas. And the way it's set up where we have 3 rotations of 4 months. So we do 4 months of like degenerative spine cases, and these are like cervical disc replacement, which means putting an artificial prosthetic device in the neck, usually to preserve motion. You have less complications or reoperations in the future, and it's really good because this program is where this all started, and they do probably more than anybody does in the country in terms of disc replacements. You can also do what's called an ACDF, anterior cervical discectomy and fusion, going in, taking out the disc or the cushion between the two bones, and then fusing that portion of the bone. It's called an ACDF. It's another operation where we operate through the front portion of the neck here. There's also some posterior cervical procedures where we go in the back of the neck. We do microdiscectomies when a patient has a disc herniation in their leg or in their neck. We can go in with a microscope and remove that disc and relieve the pressure on the nerves. There's also a procedure, it's called an anterior lumbar interbody fusion, or ALIF, where we go through the front of the belly, move the important structures out of the way, and then go in and replace that portion of the disc that's diseased or has a disc herniation or some type of bone spur. We can go on the side of the abdomen and then go down and then put a artificial disc through that way, or clean it up if there's an infection or a nerve that's compressed. So different portions of the spine. So these are what we call the bread and butter surgeries in spine surgery. And a lot of these surgeries can be anywhere between 1 hour to, let's say, 4 hours, depending on what you're doing. So we spend 4 months doing this, which is good because when you're out in practice, these are probably the most common cases that you'll see in your practice. The next 4 months, so I do this from August, September, October, November, until December time frame. Then I go to what's called deformity. So these are the big, crazy cases that we use what's called a robotic spine surgery. If you ever heard of that, we get trained on that, and then we do the surgery with navigation or computer assistance. And these surgeries can be anywhere between 4 hours and 12 hours or even longer. The patients are a lot more sicker, they have a lot more complications, they need a lot more attention. So these 4 months are going to be busier than the first 4 months. And then after deformity, I do trauma. And then trauma is at a level 1 trauma center here in Dallas, where we take call usually every few days. We're going in at 2 o'clock in the morning to do a surgery on the patient who has some type of injury to their spinal cord, to try to relieve that pressure on the nerves and the spinal cord. And then this is another 4 months of really busy, working, sometimes 12 hours, 13 hours a day type cases. And it's unpredictable. You may have surgeries that are scheduled, let's say from 7 a.m. to 4 p.m. And then you get a call from the ER and say, hey, we have this patient down here that, has a spinal cord injury, and you guys should come and check it out. So that'll be my job, to go down to the ER and go see that patient, determine whether they need surgery or not. So every fellowship is a little bit different, especially if you're in a different specialty like transplant surgery or some type of fellowships in dermatology or plastic surgery. But ours here, over that 12 months, we do 4-month blocks. So 3 4-month blocks, usually the bread and butter cases, which I'm starting off with, and then the more complex cases, and then trauma. And it's good for me for trauma to be last, because I'll be more comfortable at that time doing surgeries on my own. A lot of times the attending surgeon, the main surgeon, who's a trauma spine surgeon, he has 2 operating rooms running. So I'll have my operating room and he'll have his operating room, and then he'll come in, help me, show me this, teach me this. So it'll be good to kind of end on that, even though the second portion of my fellowship year is going to be completely busy and crazy. So that's how my fellowship year is set up. I hope this video helps you guys. Thanks for watching, and we'll see you next time.